Welcome to the Expert Series, brought to you by the Lupus Foundation of America. Our health education team is here to bring you experts in lupus to discuss topics to help you live better. Thank you for tuning in to today's episode. My name is Lauren, and I'll be your host. Today's episode is very interesting, and we will be discussing the top questions that the health education specialists here at the Foundation get from people with lupus about their skin and hair. And to answer all of our questions today, we have lupus expert Dr. Kompouras. Dr. Kompouras is Assistant Professor of Medicine and Director at the Yale Lupus Program in Connecticut. He attended St. George's University School of Medicine and worked closely with Dr. Sue Manzi, investigating novel therapeutics for lupus at University of Pittsburgh and Allegheny Clinic before moving to Yale. He's assisted in important clinical research over the course of his career that has contributed to the treatments for lupus and has developed a cohort of lupus patients for novel lupus research. He's also developed the Rheumatology Dermatology Clinic with Sarika Ramachandra at Yale. Thank you, Dr. Kompouras, for joining us today.
You're welcome, Lauren. I appreciate the opportunity to talk about this very important topic for our patients living with lupus.
Great. Well, we're just going to jump right in. Today we're talking about top questions that people with lupus have posed to some of the health education specialists. So, we're really happy to have you here with us today. So, we know that lupus can affect some of our organs, all of our organs in our body. It really kind of picks and chooses, it seems, from person to person. And one of the biggest organs, or the biggest organ in the body, is the skin. We know it's the first line of defense. And so I think it's really important that we talk about what a breakdown in that first line of defense might look like for someone with lupus. So sometimes people call us and they'll say to us, they have skin rashes and they have some other signs of lupus, but maybe their physician won't diagnose them with lupus because they don't have that quote unquote butterfly rash that is often associated with lupus. So my question is it true that everyone with lupus will have problems with their skin? And is it true that everyone with lupus has to have this butterfly rash on the face?
Well, so I think definitions here are going to be important. I think when we talk about lupus rashes, these are rashes that tend to be present for at least 24 hours. And so some people with lupus may experience malar flushing, or some people with lupus may experience sensitivity to the sun with a transient redness of the skin. But really, if we think there's a rash that's attributed to lupus, it should have been present for at least 24 hours and often is raised when you feel the rash. No, you do not need to have a malar rash or butterfly rash to be diagnosed with lupus. In fact, the new criteria in lupus, both in 2012 by the SLIC organization and in 2020, the ACRUR criteria excludes butterfly rash as a defining characteristic. In fact, they discuss or break rashes down by different types of rashes, such as rashes that occur suddenly and acute cutaneous lupus. And this might be a sunburn that doesn't go away with minimal sun exposure, or a chronic cutaneous rash. So butterfly rash actually is no longer one of the criteria. About 90% of people with lupus eventually develop some kind of rash. So it's important, if you develop a cutaneous reaction, that you should see your lupologist or your other doctors to see if this might be related to your condition. Rash is really important to handle and really to pin down, because it is one of the ways for us, or one of the big clues for doctors to realize that lupus might be occurring. So I think if there is a rash, you should see your doctor. And if the rash is doubtful in its origin, the rash should be biopsied.
That's really great to know about those new criteria. And I think that, it tells us that there's a lot more than just the flushing across the face that could be included for lupus with rashes. So can you tell us a little bit about what kinds of rashes that you as a physician might be looking for? A dermatologist, or you guys in the Rheumatology Dermatology Clinic, what are you guys looking for upon diagnosis or follow-up visits? And then maybe if there's a different, depending on skin pigmentation, darker skin versus lighter skin, what are you guys looking for?
Right. So rashes that I think are important are rashes that change the pigment of the skin. Either if you start with lighter skin or darker skin. Usually inflammation that's deep to the skin interferes with pigmentation. Either you can get loss of pigment or even hyperpigmentation. We used to think in folks with fair skin, as inflammatory rashes heal, they darken. And that's true. And we thought the same might have happened to individuals who've had dark skin. But indeed, African Americans, for example, who have darkening over the skin may in fact have an active lupus process that's not reflecting a post-inflammatory reaction from lupus. So rashes also are location, I should say, is important in rashes. Rashes that affect certain areas of the body versus diffusely can be a clue if this is a cutaneous only lupus or if this is a systemic lupus. I have a great story for you, Lauren. I grew up in the 70s and 80s, and as a child, and in the 80s, music videos came out, and recently I was watching music videos, and a video came out or came on from Seal, a musician. But Seal had a rash on his face, and I'm sitting there watching this about a year ago, and I said, does Seal have discoid lupus in the rash, or did he? And so I checked the records, Googled it, and lo and behold, Seal had a discoid lupus on his face. And so facial rash often is a clue that there may be rheumatic illness, and particularly lupus. Facial rash, if you talk about discoid, usually means cutaneous only. In other words, if you have discoid rash is a rash that's often round and typically associated with loss of pigment and redness. If you have a rash mostly on the face, you see that more commonly in folks with cutaneous only lupus or chronic cutaneous lupus. Discoid rashes that might occur in the extremities, for example, or on the trunk are more strongly indicating systemic lupus erythematosus. So location of the rash, I think, is really important. What makes the rash better tend to worsen in sunlight? That's a clue that this might be a lupus rash. There's another rash that you will see in newborns, and that's an indication of neonatal lupus. These are babies who are born to moms who have lupus and a particular antibody, and they can come out with a temporary facial rash or even body rash that is termed neonatal lupus. That resolves in time in almost all instances. There's one other rash that I wanted to mention. It's a deep inflammatory rash of the skin called paniculitis. Paniculitis is inflammation of the structures under the skin, because actually we have the skin, and then under the skin we have a layer of fat, and that's really important for insulation. So inflammation of that layer of fat can change the skin on top of that, but it would look very different than discoid rash, right? It might feel hard and it might feel puckered, whereas a discoid rash might be raised and it might be red and scaling. And so those kinds of characteristics, location, how the rashes feel to the skin, presence of scale, how inflamed the rash might be, all are important clues, I think, for the doctor to understand if there is a lupus rash.
Wow, that's really helpful. And so location, size, and the texture. But I mean, honestly, if you're someone out there who's got rashes and you're thinking maybe this might be lupus, it sounds like a physician could really weigh in on this topic and provide some clarity. Especially you talked about possibly getting a skin biopsy as well.
Right. I think for rashes that don't go away and rashes that appear to be scarring or changing the pigment and they're not responding to typical therapy should be biopsied, because more ominous things like a skin cancer and other disorders of the skin can sometimes just look like a red rash. Now, to go back to the Seal story, Seal doesn't have active cutaneous lupus as far as I could tell, but he has the damage from it. And so he's lost a little bit of the texture of the skin, and that's called atrophy. And so when we see the loss of skin structures or loss of the thickness of skin, we believe that those rashes have been present for a long time, and there's been irrevocable damage to the skin.
That brings up a really good point, because I know that a lot of folks who call us, they're really concerned. I mean, because the skin or the hair is on the outside, it's a very visible symptom of the inflammation that's maybe raging inside their body, and so it's a big concern. What have you noticed if there's any difference for men versus women as far as rashes or hair loss goes? Is one more inclined than the other to have it from lupus, hair loss, that is? Does it look any different? What are you looking for whenever you have a man versus a woman patient?
Right. Not really. I think, well, systemic lupus affects women much more commonly than men. And young women in the 20s, probably 9 to 1 women to men in terms of predilection for lupus affliction. But I think there are equivalent rates of skin involvement in both sexes. There may be a higher incidence of chronic cutaneous lupus in males compared to SLE, and males in general tend to have more severe lupus manifestations, including skin manifestations, which are active rash and hair loss. Men also have an increased risk of kidney involvement should they get systemic lupus.
Got it. Okay, so we're looking at patients kind of equally then to see if they have it, but there might be a little bit more of an increased risk for men for the rashes on the face, you think?
Right, or certainly more severe rashes. And if I had an office of 10 people waiting, all with lupus, statistically, one of those people may be a male, and that person statistically would have a higher likelihood of organ involvement and higher disease activity scores from lupus. We're not sure if that's because there's something in the genes, if there's differences the way medicines behave in males or females, or if males are coming to the attention of physicians later. It's not clear.
Yeah, a lot of factors there. Well, that's very interesting. So if there are men out there who have rashes and stuff, maybe don't wait. Know that even though there is a higher, women are more inclined, I suppose, to have lupus. There's still men do still get it. So it's definitely important for them to follow up on those things.
And Seal is a man, of course.
Yeah, of course. Yeah, I know. That's such a good example. So you did talk a little bit about in the beginning, if someone has the redness in their skin that gets further, brighter or more inflamed after being in the sun. Are there any other triggers that you know of that might make skin rashes worse, such as UV rays, or are there any behaviors that might kind of trigger those reactions?
Yeah, so quite right. People with lupus are more sensitive to UVB radiation, and probably UVA radiation. In fact, if you took skin cells from someone with lupus and skin cells from someone who don't have lupus, and you put them in a culture dish and you expose both dishes to UV light, the patient's skin cells from lupus tend to handle the UV light less well, and those cells die rapidly. And we know, therefore, that most patients with SLE do experience sensitivity to sunlight. And whether it's clear or what we call subclinical, maybe they're feeling a little extra tired the next day, might indicate that UV rays are worsening disease activity. Certain medications actually can cause rashes that are lupus related. So if you start a new medication and there is a new rash that doesn't go away, you should certainly make sure that isn't related to an SLE-like process. Or if you develop a rash and maybe had a different diagnosis, this might be a clue that things are changing for you. And of course, the immune system changes regularly. Stress and lack of sleep can increase disease activity in lupus because it causes the immune system to be less regulated when we're under stress or when we have a lack of sleep. The immune system tires out and it's less able to, as I said, control inflammation. It's not uncommon for lupus rashes to come out during pregnancy. Occasionally these rashes are acute cutaneous lupus. Sometimes discoid rashes can worsen, so that's chronic cutaneous lupus. So a change in one state, a pregnancy, for example, which is a huge physiologic strain, in some can also cause rash to worsen. But pregnancy is associated with its own series of different rashes, and in that case, it's very important to see your doctor to know if the lupus is getting worse or if it's a separate issue related to pregnancy.
Well, that's a really good point I hadn't even thought of, so I'm so glad that you brought that up. And definitely, if there are new rashes, I think you just hit the nail on the head. If there are new rashes or changes to what you expect from your lupus, definitely go back to your healthcare provider and let them know, because changes are important to note.
Yeah, and Lauren, sometimes a hint that the skin is becoming more inflamed is that people will itch more. And itch often is an indication of inflammation occurring skin deep, as it were. And patients who have inflammation in the scalp, they may be losing hair, and you look and you don't see a rash because, by the way, just like these discoid rashes, for example, cause loss of pigment, they're causing loss of hair cells because as the inflammation is deep in the cutaneous structures, and inflammation heals by scar. And so we want to prevent that because loss of hair follicles may lead to chronic loss of hair. So itchiness is another symptom that sometimes indicates cutaneous activity without seeing the rash.
That's a really great tip. I didn't know that about the itching, but that totally makes sense. And if someone is able to, if their head is itching and they've got lupus, and definitely have someone to look at it. It's hard to look at your own head, so definitely talk with their doctor.
It is,
wow.
and many of us think about 5% of patients with lupus can get hives. And so occasionally a patient may come and they're having recurrent hives. They're usually a delayed diagnosis because they're typically treated as urticarial illness or hives. And it only becomes clear when things might worsen or if the doctor checks a laboratory tests that maybe there is a more systemic inflammatory process at play.
Wow. So even people who maybe just have that cutaneous lupus, just to be mindful of, if anything becomes even more concerning, that to think about the systemic part of lupus as well, too, right?
That's right. That's right. And in general, if someone has chronic cutaneous lupus or discoid lupus, they tend not to progress to systemic lupus. We think about 5% or 10% of people with the skin-only form may go on to develop systemic lupus.
Oh, good. Okay, that's good to know. Wow. So this is such helpful information, and I know that lots of folks out there are going to be so happy to have all of these details you're providing. I have one last question that is a big one these days. We're in the middle of a polar vortex over much of the United States, and so we are definitely getting people calling, asking questions about climate and environment. So what do you know as far as what do you recommend to people who are living in warmer climates, dry climates, versus just really bitter cold in North Dakota or Alaska? Are there any special things that people can do to protect their skin or to maybe treat it if they start to see a worsening in their rashes?
So you make an excellent point. UVB radiation, or the UVB ray, right? UVA is the sunburn ray. Right? UVB rays are the rays that cause wrinkles. The rays that also can cause changes in the DNA, right, in a way. But UVB rays are unaffected by cloud cover, temperature. Or you could be, there's a similar amount of UVB. I mean, maybe a very cloudy day, it's not as much, but UVB can penetrate clouds. And so you can go out even on a cloudy day, and for those folks who are extremely photosensitive, can get significant cutaneous reactions. And so liberal use of sunscreen is very helpful for those individuals who have active, serious rashes or who have significant reactions to sunlight exposure. In fact, I often see patients who've been skiing come in with facial rash because of the reflection of the rays causes inflammation in the skin. Keeping the skin hydrated is really important because, like you said, the skin is a barrier. And the skin is a barrier to the outside, but so is the gut. And so is the lung. And so when we talk about environmental influence on the disease process or initiating disease, we look at those interfaces, the skin, the gut, and the lung. And we look at what is happening at those interfaces, and what are the cells involved at those interfaces, and how do those cells behave during normal day-to-day activities, and why do those people develop what we call a break intolerance. The point is, if you can manipulate the barriers, i.e. use sunscreen, or maybe changing the gut, or stopping to smoke, you will impact the immune function at that interface, which seems to, and this is, a lot of this is still in the works, but that seems to correlate strongly with certain disease outcomes.
That is so helpful and a great way to tie in the whole body into this. And, it's not necessarily just because it's cold or cloudy that you really have to think about all aspects of your environment around you, specifically the sun or certain behaviors like smoking or what you're eating as potential influencers or triggers for your lupus. So I love how you tied that in. That's really helpful. I think that, you've provided so much information for people out there who have questions about lupus for their skin and their hair. Is there anything in particular that we missed that you want to make sure that we impart on folks? Maybe a question out there that I didn't ask?
Well, I will say that many therapies do exist to improve skin manifestations of lupus, both chronic cutaneous lupus or skin rashes associated with systemic lupus erythematosus. There are new medications that hopefully will be available to our patients, which seem to have significant improvement, particularly for skin lupus. So we're looking forward to new breakthroughs in the management of these skin diseases. If you have chronic skin problems, do see your doctor because this may be a manifestation of another part of disease, or if you have lupus, it would be important to understand if this is reflecting internally heightened lupus activity, or if this is a reaction to some medication, or is there a new process that we need to be concerned about. So I think the skin and hair is very much like the eyes, which is the window to the soul. The skin and hair manifestations is very telling in terms of how active the lupus is, and usually response in the skin and in the hair correlates with global responses in those patients. I want to thank you for this time. I think this is a really important topic for patients with lupus. It affects most of them, but the good news is new therapies are being tailored for this yet unmet need, and we're looking forward to bringing these patients back to skin clarity.
Thank you so much. Thank you for ending on a hopeful note for all the new therapies that are out there for folks with lupus. Thank you so much, Dr. Kompouras, for your time today. And for those of you listening in, you can find more information about lupus and the skin on the National Resource Center on Lupus by visiting lupus.org/resources. For the latest information on lupus and COVID-19, please visit lupus.org/coronavirus. To listen to additional episodes of the Expert Series, you can visit lupus.org/the Expert Series, where you can also subscribe to get alerts when podcasts are released. And if you'd like to speak with one of the health education specialists, you can go to lupus.org/health educator or call 1-800-558-0121, extension 136. And finally, to connect with others with lupus from all over the world, I invite you to check out our online support community, Lupus Connect, where you can talk with others, find emotional support, and discuss practical insights for coping with the daily challenges of lupus. You can find the community at lupus.org/resources/Lupus Connect. Thank you and have a wonderful day.